Assalamualaikum. Today we are studying eponymous and basic anatomy, International Commission reflecting the views of multiple professional anatomic society determine official anatomic terminology. One of the guidelines used in producing this terminology anatomica is that eponyms shall not be used in a scientific context. An eponym is an identifying term formed from the name of a person. Bear, Walt, Foreman of Winslow, Circle of Willis. However, eponyms are not often historical misleading in that the person honored by the naming did not necessarily contribute the first description of the structure. Francis Hopper was not the first to describe the inguinal ligament. Unfortunately, eponyms remain in wide use in the biochemical sciences, especially in clinical setting. Newer generation of anatomists and health other niche health science professionals should adopt current official terminology and eponym whenever possible to reverse this trend. Basic anatomy. Basic anatomy is the study of minimal amount of anatomy consistent with understanding the overall structure and function of the body. Number one, skin. The skin is divided into two parts: the superficial part, the epidermis, and deep part called dermis. The epidermis is stratified epithelium with cells that flatten as they mature and rise to the surface. On the palm of the hand and the sole of the foot, the epidermis is extremely thick to withstand the wear and tears that occur in these regions. In other areas of the body, such as on the anterior surface of the arm and forearm, it is thin. The dermis is composed of dense connective tissue containing many blood vessels. Lymphatic system, lymphatic vessels, and nerves, it show considerable variation in thickness in different parts of the body, tending to be thinner on the anterior than on the posterior surface. It is thinner in women than in men. The dermis of the skin is connected to the underlying deep fascia or bones by superficial fascia, otherwise known as subcutaneous tissue. Here is the figure of skin. It is a shaft of the hair, plexus of arteries and veins, subcutaneous gland, hair follicle, erector pili, muscle, plexus of arteries and veins, superficial fascia, hair, blood, body of exocrine sweat gland, duct of exocrine sweat gland, and this is part is dermis and the lower part is epidermis. So it's all about the structure of skin. It has two parts like superficial part is epidermis and the deep part is dermis. So we are studying in the general structure of the skin and its relationship of the superficial fascia. Note that the hair follicle extends into the deeper part of the dermis or into the superficial fascia, whereas sweat gland extend deeply into the superficial fascia. So it's all about skin and epidermis. Now after it, the skins are joint always fall in the place. The skin creases at this side. Skin is then elsewhere and firmly tethered to underlying structure by a strong band of fibrous tissue. Here we can see the skin creases when we fold our hand. Then These lines are thinner than any other else part.